Hello, everybody. Thanks for joining us. We'll begin the presentation shortly. Give us just a few more minutes. And while you're here, I'll start with a couple of reminders. If you have any questions for us, submit the questions to the question and answer window. And if you would like to have access to the French interpreter today, click on the globe icon at the bottom of your screen. And in the meantime, you can download our free Halloween-themed hazard prevention poster using the QR code on the screen. It's available in both English and French as well. Thank you. Again, welcome everybody who's joining us. We'll begin in a couple minutes. And another reminder, if you have any questions throughout the presentation, submit the questions to the Q&A or question and answer window below. And if you'd like access to our French interpretation channels today, you can click the globe icon at the bottom of your screen. And in the meantime, feel free to download our free Halloween-themed poster using the QR code below. And it's available both in English and in French. Couple more minutes and we'll begin. Okay, I think we are ready to begin. So welcome everybody, and thank you very much for joining us today, where we'll be talking about workplace hazards that are frighteningly common and easily preventable. My name is Matea, and I'm a senior technical specialist at CCOHS. And to begin today, I'll go through just a couple Zoom items. As I mentioned at the beginning, please submit any questions that you have in the question and answer option at the bottom of your Zoom window. Today's webinar is also offered in French. If you want access to the interpretation channels, you'll find an interpretation option at the bottom of your Zoom window where the globe icon is. We put instructions in the chat as well. A recording of today's event will also be available on our YouTube channel in the upcoming days, and we'll email you when it becomes available. Before we begin today, we would like to offer a land acknowledgement. The Canadian Centre for Occupational Health and Safety, CCOHS, is situated upon the traditional territories of the Erie, Neutral, Huron-Wendat, Haudenosaunee, and Mississaugas. This land is covered by the Dish with One Spoon Wampum Belt Covenant, an agreement between the Haudenosaunee and the Anishinaabeg to share and care for the resources around the Great Lakes. And a few words about CCOHS. We are Canada's national resource for the advancement of workplace health and safety. And for more than 40 years, CCOHS has promoted physical and psychological health, safety, and total well-being of workers. So here's our agenda for the next 45 minutes or so. We're going to be talking about hazard prevention and the basics of what it is. And then we'll be covering 3 common hazards that you can find in many workplaces, specifically slips and trips, lockout, tagout, and chemical safety. And for each of these hazards, we'll provide you with next steps and actionable items that you can take back to your workplace. We'll wrap up with some time for question and answers. And as a reminder, please put your questions in the Q&A box, not in the chat. So what exactly is hazard prevention? Well, hazard prevention, it's a process or a set of processes to help to identify and mitigate any source of potential damage or harm to somebody or something. So for example, if you're a workplace with a comprehensive accident prevention program, you're dramatically reducing the frequency of accidents. Machinery breakdowns in the workplace can be prevented by following manufacturers' instructions and recommendations for things like inspection and maintenance. And fires in the workplace can be prevented by keeping combustible and flammable materials away from hot work areas, for example. Now, hazard prevention, the goal is to have a proactive approach to health and safety. We want to be able to identify and control hazards before they lead to any sort of harm to a person, a thing, or the environment. Now, why is hazard prevention important? Well, there are several reasons why, and I have a couple here on the screen. Firstly, employers have a legal obligation to prevent injuries and illnesses in the workplace. This is part of a broader topic called due diligence. And due diligence refers to employers taking every reasonable precaution in particular circumstances in the workplace to prevent harm in the course of work. So this duty of due diligence applies to any situation in the workplace, even those situations that aren't specifically addressed in occupational health and safety legislation. But hazard prevention is more than just compliance with the law. Every person in the workplace has a role to play to make sure that the workplace is kept safe and healthy. And this is called the internal responsibility system. Now, the IRS, or internal responsibility system, it's an underlying philosophy for health and safety legislation across all Canadian jurisdictions. And the foundation of it, again, is that all workers and all employers are responsible for their own health and safety and for the health and safety of their co-workers. Prevention also includes psychological safety and support, and making sure that a workplace supports worker mental well-being, not just their physical safety. Now, how to prevent hazards? There's a process for this. So in order to prevent hazards, we first have to be able to identify them. Once they're identified, we perform a risk assessment. And once we've identified hazards and performed a risk assessment, then we can identify which control measures are best suited for any particular hazard. And workplaces can identify hazards through many different ways. For example, workplace inspections, talking to workers and getting their feedback, reviewing accident investigation reports, just as an example. Once hazards are identified, then they're reviewed and assessed to determine how likely and severe a potential harm is that comes from that hazard. And this is done through a formal risk assessment approach. When it comes to hazard identification and risk assessment, the Health and Safety Committee or Health and Safety representative must be involved in the process. Now, a Health and Safety Committee consists of labor or worker and management representatives who meet together on a regular basis, and they deal with health and safety issues. Some examples of the roles that the Health and Safety Committee or representative play include recognizing and identifying workplace hazards, participating in the development of health and safety control programs, responding to worker complaints, and participating in health and safety investigations. And throughout the presentation today, you'll see this inverted triangle that we refer to as the hierarchy of controls. So when we talk about implementing control measures in the workplace, we want to relate that to the hierarchy of controls, which is essentially a risk reduction approach or process that is used to help identify and implement the most effective control measures to help people in the workplace. So it's a structured approach to control hazards by organizing control measures from the most effective, which is elimination of a hazard, to the least effective, which is personal protective equipment or PPE. So once you've identified a hazard, you've assessed the risk of that hazard, and you're ready to implement controls, use this hierarchy of controls. Start from the top of the inverted pyramid and make your way down. The most effective way to reduce risk, as I mentioned, is elimination. And you can continue this process as you move down through the inverted triangle. For example, substitution means if you have a hazardous chemical, you can substitute it with a safer alternative. Layering multiple control measures for any hazard is the most effective way to improve your overall effectiveness of controls. Once you've identified control measures using the hierarchy of controls, then you have to make sure that they're actually working and that they're effective. There are many ways in which you can do that. Workplace inspections are a good starting point. You can talk to workers and get their feedback about whether the control measures have been working for them, or you can undergo formal audits either internally or externally to ensure that your controls are working. So now that we've introduced and looked at the topic of hazard prevention, let's look at some of our common hazards in the workplace. Again, we'll focus on slips and trips, lockout, tagout, and chemical safety. And let's start today with slips and trips. Now, slips and trips are very common in the workplace and can occur on flat surfaces, they can occur on stairs, or they can occur when working at low heights. And I mentioned low height specifically because anything that is done or any work that's done above 3 meters is considered working at heights and would require a formal fall prevention program. For the purpose of today, we'll be talking about work that's done below 3 meters and not working at heights. Now, when it comes to slips and trips, there are many different causes. So for slips, for example, some common causes include slippery materials like water or ice, snow, oils, or powders on the floor. Slips can also happen because of slippery surfaces themselves, like polished tiles being really slippery or smooth painted concrete. And inappropriate footwear for a specific surface can also lead to slips in the workplace. Some common causes of trips now include uneven surfaces, unexpected or unseen steps or platforms or thresholds, wrinkled carpeting or loose rugs or mats in the office, for example, even obstructions like open file cabinet drawers, or exposed or loose cables, wires, or cords, or even simple clutter on the floors or on stairs can cause people to easily trip in the workplace. So how can we reduce the risk? What can we do about slips and trips in the workplace? The best way to reduce risks of slips and trips is through housekeeping. Now, housekeeping is a fairly large topic, but it is the most important aspect when it comes to preventing slips and trips in the workplace. So some examples of what housekeeping can mean in the workplace include marking and cleaning of spills immediately. So if you have a puddle on the ground in the office walkway, not waiting for someone to slip and trip, and cleaning it up instead would be a great way to reduce the risk. With the cold and upcoming winter that we have, cleaning of ice removal with sand or salt, depending on the circumstances, is a good idea. Mopping or sweeping debris from the floors, like chips or shavings or dust. So you might have debris coming from a production line, or you might have simple debris from garbage on the floor that should be cleaned up. You want to also remove obstacles from walkways, like boxes or random chairs or tables that might be in the way. You can secure mats and rugs and carpets with tacking or taping. And finally, you can implement a formal housekeeping program. It doesn't have to be complicated or costly at all, but a housekeeping program will help to document all the different ways in which workplaces will help to keep people safe from slips and trips. So a housekeeping program can include things like daily and monthly inspections, depending on the work being done and the task being performed. Maintenance of building and equipment, and dust and dirt removal. So things like your ventilation systems and making sure that you're using the right vacuum for the job. Excuse me. And lastly, your housekeeping program, you want to make sure that you have a way for workers to report hazards to their supervisors. So although housekeeping is the best way to reduce the risk of slips and trips, there are other ways to reduce the risk in the workplace, starting with flooring. So changing or modifying walking surfaces that are slippery will help reduce the risk. So you can add salt on icy walkways, you can recoat or even replace floors, and you can install mats where appropriate. Proper footwear is also really important. So in workplaces where floors might be, let's say, oily or wet, or where workers spend a lot of time outdoors, selecting the correct footwear will help to keep them safe. And you can always check with the manufacturer as well to make sure that the footwear that you've selected for your workers is appropriate for the task being done. Now, properly fitting footwear also increases worker comfort and prevents fatigue. So both of these factors will help to reduce the risk of falling in the workplace. Now, when it comes to falls, ladders are a common cause. And ladders, if you fall off of one, there can be potentially serious consequences. So again, when we're speaking about ladders in the next few points here, we're talking about work that is below 3 meters. So a few ways to reduce the risk of falling when you're working from a ladder include facing the ladder itself, keeping your body centered between side rails, maintaining a firm 3-point contact at all times. So that means either keeping 2 hands and 1 foot or 2 feet and 1 hand on the ladder at all times, and placing your feet firmly on each rung. So with housekeeping, flooring, footwear, and safe ladder use, you could reduce the risk of slips and trips in the workplace. Now we're going to do a quick poll for everybody. We have a couple of them throughout the presentation today. And the first poll asks, how often does your health and safety committee perform workplace inspections? Is it once a week, monthly, every few months, once a year, less than once a year, or I'm not sure? I'll give you a couple moments to select your choice. Okay, we should have the answers coming up shortly. Okay, so we have the results here, and 66% of you have said that the Health and Safety Committee performs monthly workplace inspections, followed by every few months. Some of you had said once a year, once a week. Some of you are not sure, and some of you had said less than a year. So the answers really vary. And how often committees have to perform workplace inspections also varies based on many different factors. For example, the legislative requirements in your jurisdiction. So I'm based in Ontario, and in Ontario, health and safety committees have to perform monthly workplace inspections. And where monthly inspections aren't feasible, then they have to inspect the workplace at least once a year and ensure that at least the entire workplace is done, or at least part of the workplace, excuse me, is done every few months. So legislative requirements will dictate how often workplace inspections are done, but so will things like your past incident reports and the number and size of your operations, the number of shifts that you have, if you have new processes or machinery, or if you have really high hazard workplaces or activities. These can all lead to more frequent workplace inspections. And for those of you who are unsure, this is a great way to get involved with your committee or your representatives and simply ask them for previous inspection reports, or ask them how often they perform these inspections. And you can also ask your supervisor as well. Okay, thanks for that. So with slips and trips, what are the next steps? What can you do and take back to your workplace for actionable items to reduce the risk? You can develop or update your program. So if you don't have an existing housekeeping program, you can develop one with the help of your health and safety committee. You can include information on how workers can report slip and trip risks, and also include information on how you are going to maintain housekeeping. So for example, if you have completely cleaned up a room that's full of tools and equipment and everything is in its place, and if you come back a month later and it's chaos again, then you probably have to go back and regroup and see how you can maintain that cleanliness and the housekeeping in the area. When it comes to hazard controls in place, again, we're looking at the hierarchy of controls, and throughout the 3 hazards that we're going to be looking at, we'll give some examples of control measures based on the hierarchy of controls. So for slips and trips, an example of an elimination of the hazard is removing the rug that's constantly causing people to trip, or actually trapping shavings from the production line before they reach the floor where people can trip on them. An example of PPE, or personal protective equipment, for slips and trips is mandating slip-resistant shoes if that is what the environment requires. So for example, if there are workers who are exposed to slick floors, like those that are wet or greasy. So that was our first hazard of slips and trips. Now let's move on to lockout, tagout. Now, lockout, tagout, or isolation, there are several terms for it. It is a complex topic, and it can have really severe consequences. For the purpose of today's session, we're just going to be covering the basics of lockout, tagout programs. A lockout, tagout program is going to reduce the risk of injury from unintended release of hazardous energy. And when you have unintended release of hazardous energy, injuries can be catastrophic. And they can include things like amputations or crush injuries, electrocution, and even death. And when we're talking about hazardous energy that needs to be isolated or locked out and tagged out, we're including things like electrical energy, mechanical energy, hydraulic, pneumatic, chemical, nuclear, thermal, gravitational energy. So if you have any of these sources of hazardous energy in the workplace, it's time to start thinking about an isolation or lockout tagout process. So what does lockout and tagout actually mean? So lockout isolates the energy that we've just talked about from a machine or an equipment or a process using a locking or a blocking device. The tagout portion of lockout tagout attaches a personalized tag from a worker that includes their name, the time and date, and the reason for the lockout. And you want to perform lockout tagout in the workplace when there is an unexpected startup or potential for unexpected startup of equipment that can cause injury. So think of things like maintenance or repairs, cleaning activities, if there's new installation of an equipment or you're clearing a jam. These are all examples of when you would want to have a program in place. And again, I cannot stress the importance of a lockout tagout program because of the really severe consequences of injury. Now, here are some examples of energized equipment that you may have in your workplace that would require a lockout tagout program. So we have conveyor belts and grinders, escalators, elevators, robots. And some energy sources that you see here are obvious, and they come from things like electricity or heat in a furnace or an item that might fall. But there are energy and equipment that is a little bit more hidden. So for example, if you have air pressure in a system or a tightly wound spring, these are all sources or potential sources of hazardous energy. Lockout tagout is not just about putting a lock on a piece of equipment. It is a really controlled, documented, and step-by-step process that has to be performed only by competent people. And a lockout tagout process will involve things like communication of hazards, coordination of roles and tasks, and training and education of all people that are involved. And when we mention competent or authorized personnel that have to be part of the lockout tagout training and program, we're talking about people that have knowledge and training and experience in such a system and activity. So how can we reduce the risk of the potential or unintended release of hazardous energy? A good way to do that is through a formal lockout tagout program. And again, without going into too much information about what the program entails, I'll cover just 5 of the main steps that are elements that are typically involved. So the first thing that you need to do is identify sources of hazardous energy in the workplace. Now, identifying types of energy in the workplace and getting information about the system from manufacturers is really important. The manufacturer will be able to tell you information about the procedures for the use of the equipment, or for servicing the equipment, how to address malfunctions or jams, and just how to install or remove any parts of the system. So as many hazards, and like we mentioned for slips and trips, the first thing you want to do is identify the source or the hazard in the first place. Once you've done that, you want to perform a risk assessment, again, using a risk assessment approach. And a risk assessment should be done for many tasks involved around the machinery, equipment, or process. So things like testing or startup, unexpected startups, or restarts as well. Once you've identified and assessed the risk, then you're ready to implement control measures using the hierarchy of controls. Training and education is a really big part of a lockout tagout program. Employers need to be able to communicate the program to all workers and to provide education and training on what their exact roles and responsibilities are with respect to the program. And lastly, the final element for a lockout tagout program is inspection and auditing. So again, like many hazards, you are identifying the control measures and also making sure that the control measures are effective. So what does a lockout tagout program help do? Well, it's many things. It helps prevent contact with a hazard when you're performing tasks, again, like maintenance or cleaning tasks. A program will help to prevent unintended release of hazardous energy. It'll help to prevent unintended startup or motion or movement of machinery. And it'll help prevent re-energizing a machine or equipment while workers are still near it. Now, within a workplace, typically an organization will have one overall lockout tagout program, and then each individual machine or equipment will have a detailed work instruction that describes the exact step-by-step process on how to lock out that machine. Okay, we are ready for our second poll here. So is there equipment in your workplace that requires lockout tagout? And your options here are yes, no, or unsure. I'll give you a couple minutes for that. Okay, and I have the results here. So 71% of you said yes, 21% of you said no, and 9% of you said unsure. So the results are mixed, and that makes sense because there are many different types of workplaces and people that are in the chat or in the webinar today. If you're unsure, then I suggest you talk to, again, your health and safety committee or health and safety representative, or ask your supervisor or employer for more information on if there's any equipment that requires lockout tagout. And for those of you who do have equipment that requires lockout tagout, then reviewing and looking at your lockout tagout program with your health and safety committee or supervisor is another great way to get information about the hazards in your workplace. So what are some next steps for workplaces when it comes to lockout tagout? As I've mentioned many times, identify the sources of hazardous energy. And that means you're looking at your machines, your equipment, and processes that may require lockout. And for each of these, you want to establish a written lockout procedure. And when it comes to hazard controls in place, having a lockout procedure itself is an administrative control. But looking at the hierarchy of controls, think of ways that you can maybe even eliminate the hazard altogether. So for example, use technologies that don't require people to interact with the equipment at all. So you can have an automated system for lubricating a machine that doesn't require a worker to actually go in and apply grease or lubricants. And administrative controls include things like having the procedures and having training and education and signage as well. And our last topic of the day today is chemical safety. So chemicals, again, a fairly large and complex topic, but one that is present in pretty much all workplaces. So how do chemicals actually enter our bodies? Well, there are several different ways. The first one being inhalation, or actually breathing in the chemical. A chemical can enter your body through skin contact. So you can have a burn, which causes the chemical to be introduced into your body, or it can just be absorbed through your skin. Eye contact or eye absorption is another way in which chemicals can enter our bodies. Accidental ingestion, meaning you're eating or drinking contaminated foods, or your hands are contaminated with a chemical, and then you're touching your eyes, your nose, or your throat. Or excuse me, yeah, your eyes, your mouth, or your nose. And lastly, injection. So for example, in healthcare settings, you might have someone who is accidentally injecting a chemical into their body. So a chemical safety program is another program that can be one way to reduce the risk in a workplace. So with a chemical safety program, there are many elements involved, but essentially you want to make sure that workers understand the dangers of the chemicals that they're working with, how to work with them safely, and how to respond to emergencies. So because chemical safety program is a complex program and it involves, procedures and training and information for purchasing chemicals, we've included 4 things of what is important for workers to be able to answer when it comes to your chemical safety program. So again, your workers should be able to answer, what are the hazards of the chemical I'm working with? How can I protect myself, whether that's through ventilation or training or personal protective equipment? What do I do in case of an emergency? And where can I get further information? Now, WHMIS, or Workplace Hazardous Materials Information System, is one example of a chemical safety system that's used across Canada. And it is a legal requirement in every Canadian jurisdiction. However, WHMIS does not cover all chemicals. So for example, WHMIS doesn't cover things like consumer products or pesticides or drugs and cosmetics. And even though WHMIS is specific for materials that are defined as hazardous products, an employer is still responsible to make sure that no matter the product, people know how to work with them safely, how to respond to a spill, and how to protect themselves. When it comes to chemical safety, employers and workers both have responsibilities. So from an employer standpoint, knowing what chemicals you have in your inventory and keeping that inventory up to date. Confirming WHMIS requirements for the hazardous products that you're working with or that you have on site. Performing risk assessments and identifying control measures. Developing safe handling procedures. Keeping your safety data sheets or SDSs up to date. and providing education and training to your workers. Now, from a worker's perspective, you want to know what chemical you're working with and what the hazards are associated with the chemical. You want to know where to find safety data sheets, whether that's in a physical binder or perhaps online. You want to follow the procedures that have been provided to you by your employer and use the hazard controls, again, whether that's a ventilation system or personal protective equipment. You want to make sure you're attending WHMIS training and you're reporting concerns to your employer or your supervisor or your health and safety committee member. And please do not use products unless you've been trained to do so. And time for our last poll today. So when was the last time that you took a WHMIS course? The options here are within the last year, it's been a few years, or never. Okay, and most of you, 61% of you said within the last year, some of you said it's been a few years, and a few of you have said never. So when it comes to WHMIS training, again, if you are working with a hazardous product or you might be exposed to something that's defined as a hazardous product as part of your work, then your employer is required to provide you with education and training. So this is another great example of where you can ask your committee or your supervisor for more information if you require it. Okay, so next steps. Similar to the other hazards that we've looked at, if you don't have a chemical safety program, you can develop one or you can update one. And the goal of the program is to make sure that workers know how to use the products that they're working with and they know what to do in case of an emergency. An example of a hazard control that you can put in place for chemical safety, we can see substitution as an example. So if you have a solvent-based paint, you can replace it with a water-based alternative. And just finishing up here, going back to the beginning of the webinar where we talked about prevention. Now, the goal of hazard prevention is to reduce the number of incidents and injuries in the workplace. And this is typically achieved by following a process of identifying a hazard, assessing a hazard, and putting in control measures. And in an organization that has a prevention mindset, managers and supervisors and workers share a common value to make sure that everyone at work is kept safe. Now, in addition, workers who work in an environment where they feel like their safety is being helped, they will feel more secure and engaged. And higher levels of confidence in safety protection from the workplace, from the employer at work results in lower rates of psychological distress and mental health issues as well. So workers should go home at the end of the day safe and sound and proud to be part of the work that they do. Now, just some key takeaways for the presentation today before we get on to the Q&A. Review your health and safety programs. Now, see if you have chemical safety programs, housekeeping programs, lockout, tagout programs that need to be perhaps even developed or reviewed. Include common hazards in your workplace inspections and communicate hazards and the control measures that are being implemented to workers. Now, getting worker feedback and communicating to workers is really important because workers know their job the best and they'll be able to give employers a lot of information about the hazards that they're working with. You can also investigate near misses as well as incidents in the workplace and see what root causes of accidents are to get more data. And once you have this data, review it and see if there's any trends or any areas of opportunity to be able to identify new hazards or control measures in the workplace. Okay. So thank you for that. We will now take some questions. Again, if you haven't submitted them, there's a Q&A box below. And if we don't get to your question today, we will get back to you at a different time. So let me just open up the questions here. Okay. So the first question we have is, why is PPE considered the least effective? So if you remember the hierarchy of controls, the inverted pyramid, personal protective equipment or PPE was at the bottom of the pyramid as the least effective control measure. When it comes to control measures, the best way to control a hazard is to eliminate the hazard completely. If you're looking at PPE, some of the reasons why it's the least effective is because the hazard is still there. So if you have, for example, somebody who is working at heights, then if you are providing fall prevention equipment, the job is still there, the height is still there, and somebody can still fall. So you're relying on equipment and worker behavior, human behavior to be able to keep people safe. So when you're thinking about hazard controls, the best way is to control the hazard at the actual source. So another example is if you are working with chemicals. If you cannot eliminate or substitute that chemical with something else, you want to look at things like ventilation. So ventilation can consist of a local exhaust fan where you're actually taking the dust or the aerosols from the production itself and taking them away from the worker. A respirator can be used. However, again, the best way to get rid of a hazard is at the source itself, rather than rather than going back to the worker and ensuring that they've been fit tested, that they don't have a beard, that they're wearing their PPE correctly. So these are some of the reasons why. Second question here is it okay if only health and safety and quality managers do the inspection? So it depends really on a few things. I would say always check with your legislation or in your jurisdiction to see who is required to perform the inspections. Um, Supervisors as a whole should be performing inspections as part of their roles and responsibilities of keeping the workplace safe. But you really do want to include the Health and Safety Committee and the Health and Safety Representative as part of your inspections. Again, it's part of that internal responsibility system where everybody is sharing the role of health and safety responsibilities, and we're not leaving the responsibilities just to the supervisor. Okay. How often is WMIS training required? A great question. Again, look with your health and safety jurisdiction or legislation. Typically, health and safety or WMIS training is required for many different reasons. You might perform a refresher training if you're working with new chemicals, if the chemical has changed, if the supplier has provided you with new information about the chemical, and so on and so forth. So typically it's required, as soon as you start working with the chemical, and the best practice or good practice would be to perform training annually, or again, if new information comes out about the chemical that requires people to have that information to work with the product safely. Okay, next question. Is WMIS required for employees who work in an office setting? Great question. Office settings are not immune to working with hazardous products. So depending on the office setting, you probably do need WMIS training. So it's important to be able to, again, I sound like a broken record, but identify the hazards in your workplace. If you do have a hazardous product, then WMIS training would be required. If you are working with, consumer products like cleaning products, then perhaps WMIS training isn't required. However, you still need to know how to work with those products safely, and an employer would be required to provide you with information and training. Next question. Can safety data sheets or SDSs be kept online only without the need for a physical binder on site? The answer to that is typically yes. Online or virtual SDSs are acceptable. Check with your jurisdiction and your legislation to be sure. But when it comes to safety data sheets, the really important part from an employer standpoint is that they're made available and that they're made easily accessible to employees. And from a worker standpoint, you want to make sure that you know how to find the SDS. So again, whether that's a physical binder or in a virtual setting, may depend on the workplace and what they're comfortable with and what works for them. Okay, a couple more here. Are we responsible for preventing slips and trips and falls indoors and outdoors? The short answer to that is yes. So identification and control of hazards has to be done for the entire workplace, whether that's in an indoor setting or in an outdoor setting. So if you have slips that can occur in icy parking lots outside, then that should be identified and mitigated. So yes, make sure that seasonal hazards are addressed and that control measures are identified there too. Okay, we have a couple more minutes here. Who should take lockout, tagout training? So essentially anyone who's involved in the lockout tagout process, who might be involved in working with the control of hazardous energy, should take training and should have education. And this includes the supervisors and managers that are part of that role. I have another question here. I think we have a couple more minutes. How big does an organization need to be to warrant a workplace health and safety committee? Great question. Again, check with your health and safety legislation, as typically the legislation will give you a number as to how big the organization has to be when implementing a health and safety committee. So for bigger organizations, let's say 20 or more is a typical number. Again, please check with your jurisdiction. A health and safety committee is required. For smaller workplaces, a health and safety representative would be required. And there are some workplaces as well, depending on what chemicals you're working with. So if, for example, if you have silica or asbestos in your workplace, but you have a smaller workplace, you might still need to have a health and safety committee. Last question for the day. How do we know which hazards to prioritize? So yes, there are many hazards in the workplace. I'm sure you will, through your hazard investigation and identification process, see a lot of hazards, and you prioritize them basically you prioritize them based on the risk. So how severe and how likely the harm is to the worker. And that's where the risk assessment is really important, because you're prioritizing and ranking hazards and putting control measures, because we understand that not every single hazard in the workplace will be able to be controlled immediately, but the risk assessment process will help to rank and prioritize those. Okay, I believe that is our last question of the day. So thank you all for joining us. I hope you had a good time, and thanks for your participation in the polls and in the Q&A. Please take a few minutes to fill out our short survey that will open in a new tab once the session ends. And you can help make our events even better in the future. So all registrants will receive a link to the recording of today's presentation in the coming days. Please look out for that in your emails. And again, thank you very much for joining us. Bye for now.